lockdowns have opened, hospitals were functional. How do I reach my doctor? And it's the fact. Whenever any family member needs any consultation, the whole family was pouncing upon him to say, no, please, can you avoid it? Can we not go into it? So the options next, can I sit at my home itself? And can I still have some doctor's review? Unlike my own patients, as a friend, of course, they do call me, I need this help, and I can even WhatsApp or put in some kind of consultation or can advise them, okay, you take this medicine, but that's not a fair thing to do. If I would prescribe something to a medicine without even examining or having a look into it. So what is going to come up in post-COVID times? And that is where this topic is very important for each one of us who's a health science personnel. The time is changing. The time will change. And what will come up is this. So many of you, by the time you pass out and get your degrees and have your graduations or post-graduations with you, I think whatever we may have taught you would have changed. So this is where we have to prepare ourselves for our future. And that is what we have the expert who's already started some things like this to give us an insight in it. So I would now hand over the mic to the principal of Pharmacy School, Dr. Chavi Singla, who would introduce the speaker.
Thank you, ma'am. Thank you, sir, for inviting our invitation and sparing the precious time for coming over there. To introduce about sir, a few words about sir. Like sir is a renowned optometrist who is having a more than experience of 39 years. He graduated from AIMS, New Delhi in 1977 and completed his M.Optom from Lotus College of Optometry, Mumbai. Sir is the founder director of Optic in Vasant Vihar, New Delhi. He is the past president of Asia Pacific Council of Optometry and Indian Optometry Federation. Sir was a board member of the World Council of Optometry, World Optometry Foundation, and Optometry Council of India. Sir was also the clinical director of the Special Olympics Opening Eye Program in India. Sir is also an avid tennis player and plays for the Indian senior tennis team and represents India in international championships. Sir's specialization includes low vision aids and specialty contact lenses. This is very brief about the sir, but sir is having more than other things under his arm. So it's my privilege to ask sir to start this conference webinar.
Okay, I would just, before sir takes over the mic, a small housekeeping note. For all those who are viewing us on YouTube Live, you have your chat box. That chat box gets in the messages straight to us. So any points, questions, please, as you go through the presentation, you please continue to put those questions in the chat box. And we are all here. We can get to those. So YouTube Live friends, please continue to post your answers. Over to you, Ajeet.
Thank you, Professor Monica Chaudhary, and thank you, Dr. Chavi Singla. And I would like to thank Ansar University for inviting me and giving me this opportunity to speak to students of pharmacy, students of medical lab technology, students of cardiovascular technologies, and psychology and optometrists. So it is a great privilege for me to be here and speaking to all of you this afternoon. Being, as all of you know, that AHP bill, which is Allied and Healthcare Professional Bill, is around the corner, and many of our professions are going to be among healthcare professions. So it is very important and pertinent at this point of time to understand about other healthcare professions and what is happening in India, what is happening internationally, and what impact telehealth or telemedicine is causing or creating in a healthcare delivery. And this is what I'll be speaking to you about this afternoon. And I'm not really an expert in telemedicine. I'm just a private practitioner and happens to create or get involved in telemedicine because of my passion to play tennis. I play for Indian team, and because of that, I have to spend a lot of my time on the tennis court, playing for national team, playing for Indian team, and for Indian team outside India. As a result, my lot of time is committed out of my practice. And to stay in touch with my patients, I have been working on telemedicine or creating a kind of atmosphere in my clinic so that my patients could stay connected with me. And that has been my background and the experience of implementing telemedicine. And when COVID 19 hit us and we were asked to lock down, we created this opportunity to look at this new scenario, a new paradigm, and implement it in our practice in a different way. And I'm very happy that we have been able to create a kind of atmosphere where we could examine patients virtually and we could, our practice did not, though in last 4 months, I have hardly seen four patients face to face. All my consultations have been virtual, and that has given me a kind of more confidence to look at this emerging trend in a broader way and understand what is happening in other field of healthcare, and that is what I'm going to share with you this afternoon. I'll give you kind of a basic history of how telehealth came into practice, or how telehealth came into existence, and what is telehealth, what are the etiquettes, how each one of us need to incorporate, need to embrace this technology, how we can be a part of it, and why we need to be a part of it, and what are the barriers in implementing it. So this is something going to be not a kind of a scientific talk, but just a kind of my experience of handling this, or my experience of practicing this technology. And I would suggest that those of us who are looking at healthcare seriously and futuristic, with a futuristic view, have to see this, have to understand this concept and try to implement it wherever they are, whichever area they practice. Well, if you go back to the history, I will just touch a few points that in 1876, telephone was invented, and there was an article in 1879 in the newspaper called Lancet that radio invention will bring down or will reduce the visits of patients to the doctor. And this was something very surprising in the sense that that invention, later in 1924, we saw the interactive television coming up. And even when if you look at today's scenario, we watch the most of the doctors, we see most of the doctors telling their comments that there's always something or other happening on television on healthcare. So that is something what telehealth is all about. And healthcare was very quick to adopt it. And in 1906, first time ECG was transferred to a doctor by telephone line. In 1950, telepsychiatry, because telepsychiatry was the first one to adapt telehealth into the practice. By 1960, radiology was the second one. And then in 1990, dermatology came up. In 2015, we saw, by 2000, we saw telepathology coming up. And ophthalmology and ENT, which is mostly the otolaryngology. Ophthalmology came up somewhere, started maybe at one or two places around 2000, but few of the practices that embraced that was in 2015 and 2020. We saw ENT or otolaryngology coming up into the practice. What we saw immediately happening with the COVID-19 lockdown, that the development which happened in last 2 months, it would not have happened in 20 years. This was something, a kind of thrusted on healthcare professional. It was a kind of blessing in disguise for all of us that this profession came, this technology came, and healthcare professionals were very quick to adopt it. And it was happening, not that telemedicine was not there earlier. We had in 2016, we had about 15 million of telemedicine consultations, and they have really grown up by 32 million at this point of time. And the growth which has happened in last 3 months in telehealth is remarkable. The companies who invested in telehealth technologies, they have really their stocks, their prices, their shares have gone up tremendously in last 2-3 months. And this suggests that this is a new area where each one of us needs to show interest and adopt it into their practice. Well, I would tell you, like, when we fall sick, and you have to look at what are the most of the problems patient faces. I'm not just talking about optometry, I'm talking about general health care. If you look at the most of the time people see a doctor, if you start from the general health conditions, we consult a doctor for our fever, we have cough and cold, then we have problems like diarrhea, vomiting. These are the few common symptoms. And most of these symptoms, whether it is in ophthalmology, it is conjunctivitis. If you look at ENT, it is the earache. Patients wake up with the ear pain. And then you have problems like, rashes sometimes in the wound. You have the skin dermatology issues. So these are the few low-hanging fruits, what we call them for telehealth professionals. And most of these can be handled or are being handled by the experience or by the evidence-based practice of the healthcare professionals. And they are being done very successfully and very, to be precise, very accurately in this time. And other issue which we see very pertinent at this point of time, COVID-19, if you look at even our governments have told that we should stay indoor even if we have the problem of, even if we are infected with COVID, because you can improve better at home. You can do better at home rather than coming to hospital. Suggest that healthcare in time to come, whatever may be the resources spent by the government, has to be in your inpatients' houses. Our healthcare spending, which is 2%, cannot cope up with the hospitalization expenses. And in future, remote monitoring of patients has to be done from their homes. And this is something that we have learned during this COVID-19 period. Well, I'll come back to what exactly is telehealth. See, it's a combination of two words. One is tele, which means distance, and health is, definition of health seems to have changed in the last few years. Health was considered as an absence of disease, but if you look at even our government's way of looking at the health now, it is called wellness. We are not only talking about just that the patient should not have diseases, but we are talking about health prevention, we are talking about health education, we are talking about the patient needs to be healthy, the patient needs to be happy, and this is something that has changed. So the concept of telehealth is healthcare remotely, remote healthcare, whereby your healthcare provider and patients are not in the same locations, but they are connected by a tool, which is a digital tool, which is a technology. So when a technology is introduced to provide a healthcare, and healthcare, not only I'm talking about like even what we are communicating or discussing now, tomorrow it will be on, today it will be on YouTube, and many other students and many other healthcare professionals will be watching this. This is telehealth, whereby you are promoting health, you are talking education of health, you are talking about prevention, you are talking about education, and this is what telehealth covers. Telemedicine is just a telemedicine is just a small concept of telehealth, which only covers practice of medicine, which is only clinical aspects. So that is why we need to talk about the broader term, which we understand or which we need to call telehealth. So understanding that we don't have to just be specific only on treatment part. We have to cover therapy part. We have to cover counseling part. We have to cover rehabilitation. We have to talk about monitoring of patients. So this all telehealth covers. So if you...
So just to pardon me, if you could be a little more louder. So I think in the YouTube, the voice is getting less clear.
Okay, let me try and put the microphone.
Sure.
I'll just see if you just... Let me know if it is better than this, because... Okay, just Monica, can you... Is it better?
Yes, it's much better. Yes.
It's better. Okay, thank you. Sorry, you should have told me earlier, because sometimes we don't realize, and this is something I'll be talking to you about, the etiquettes of telehealth. That what should be your mode of communicating? What should be your verbal verbal pitch of talking to your patients? This all we'll be covering today, and so the telehealth visits are basically of rather four types. What are the... How do you use the technology to connect to your healthcare provider? The first type of visit is called synchronous. Synchronous, if you look at the word, the way I remember it's when S stands for syn and S stands for seen. When you can see your healthcare provider and speak to him directly on any technology, that is called a synchronous technology. Synchronous technology, like I'm talking to you, all of you using the Zoom platform today, it's a synchronous technology. When we talk on a WhatsApp platform, we see your face and we communicate, it's a synchronous technology. Asynchronous technology is when you record a data, when you store a data, and you forward it to the person, to the healthcare provider, and healthcare provider takes its own time, sees your report, and gives its own diagnosis or management within 24 hours. That platform is called asynchronous. So asynchronous could be your email, asynchronous could be your SMS, asynchronous could be your WhatsApp message. So these are the two basic synchronous and asynchronous platforms. And then you have a hybrid whereby part of it could be synchronous, part of it could be asynchronous, whereby you can speak to the doctor and doctor can send you the treatment later, or doctor can advise you some exercises later by email. So it could be a mix, which is called hybrid. The third is remote patient monitoring. Remote patient monitoring is something which is going to be a future, not only in westernized world, but even in India, because of aging population is going to increase, and we will be seeing more and more people with chronic diseases, and remote monitoring is going to be the future of telehealth, a future of most of the healthcare. And this is what I'll be sharing to you how and why. As I mentioned, the technologies what we can use, it could be a telephone. Previously, telephone was not supposed to be a kind of a technology for which a doctor could be paid, but now a telephone consultation is also reimbursed by some of the insurance companies. And recently, insurance company in India also have, which is called IRDA, which is a Regulatory and Development Authority, have allowed all telehealth consultation to be reimbursed to the doctors. And this is something good sign, and this is something very positive, whereby doctors can be paid for talking to the patient by sending email, by sending SMS, WhatsApp, all these platforms, Skype, Zoom, FaceTime. So whatever communication doctor and patient feels can be a medium for your consultation. And what is the most popular consultation mediums are, which we are discussing today, is if you look at Zoom, which has become the most popular platform in India, not only in India, but it's going to be worldwide. I was listening to one of the interviews of the Zoom inventor. His name is Eric Juan. And he says that in time to come, we are going to make this platform very, very interactive, whereby a doctor and patients could shake hands on Zoom. When you put your hand forward, patient's hand will come forward, and two of you would look like as if you are just sitting face to face. If you look at the Zoom, I mean, approaches today, even yoga classes, some of the marriage functions, some of the burial functions. Excuse me. So they are going to be part of a two-way video conferencing, and Zoom, Doximy, Google Hangout, Cisco, and Google Meet. These are a few of the platforms of telehealth which are being used in education, which are being used in healthcare promotion, and which are going to be the part of telehealth. Okay, now understanding what are the etiquettes, what we need to follow on telehealth. First of all, we have to understand that this technology is something which is new for your patient, which is new for doctors also. We are never taught in our medical school, we are never taught in our colleges how to communicate to patients by this technology. So this is something, a part of our education, which every health institution, which every health science department needs to teach to their students. First and most important thing what we need to see is this, that you need to, since there's no much visual contact with patients, we can't see their responses. So we have to see that our contact with the patient is eye to eye. And how do we make eye to eye contact? We, most of the time when we speak, we tend to put our computers at a different gaze. We need to make sure that our cameras of the computers are just at our eye level, and the person who is speaking directly into the camera, is looking straight into the camera, and that will make an eye contact. Sometimes we make mistake of looking down, looking here, looking other side, and thinking that you are looking at the person, but actual eye contact will happen when you are just straight at the 2 meter height, sorry, not 2 meter, but at 2 feet height, 2 feet distance from the computer screen. Because if you go too close, your face will look very big. If you're too far away, the clarity will not be there. So stay about 2 feet, whereby you are just covering your shoulder, your face, your half, this up to this level. And this is how you need to be positioned. Make sure that you introduce yourself first, that you are so and so, and you are talking to the person for this particular problem. You need to make sure that the patient's appointment is fixed and you are talking to the same patient. Sometimes you may be surprised that since your ID and your link remains the same, sometimes you may miss a patient and sometimes there could be somebody else. So identity of the patient needs to be established before you start your telehealth consultation. Your facial expressions needs to be good in the sense that you need to keep on checking, keep a mirror close by, whereby you keep on checking your expressions, your verbal expressions, your verbal clues. Make sure that you're not shouting on the camera. Make sure because we feel that you're sitting too far away, you're sitting in Ansel University. So I have to shout at that level. But your voice should not be too deep, and always keep a bottle of water, because when you speak for longer time, you may have problem lubricating your throat. So these are some things what we need to maintain. Third thing is this, that always listen to the patient and listen to the expectation of the patient. Be empathetic to the patient's need, understand that he has some problem and try to repeat, which suggests that you are listening. Don't be distracted. When a patient is coming to a clinic, the privacy is our issue. But when we are on Zoom or to a video conferencing, the privacy is half with you and half with the patient, because patient is also at home. Always check where the patient is and what the location is, because you need to find out patient is calling from where, is communicating from where. And being a healthcare profession, not just, I'm not talking as an optometrist, you may be in other healthcare professions whereby conditions or the driving of the patient could be important. So make sure that all those details are filled up. And be present, be presentable, make sure that whatever time, because telehealth doesn't have any time. And make sure that you are dressed well, you are presenting yourself in a very appropriate manner. If you are a person, if you are a doctor who have a habit of wearing your white coat always, then you make sure that you wear your white coat on your consultation. But if you don't, then you can avoid it. So keep certain protocols, keep certain etiquettes, make sure you're not eating while you're doing your telehealth consultation. Make sure you're not being disturbed by people around you, because that's something which is a privacy issue. Make sure that all protocols of your compliance, which may be important for your insurance reimbursement, are fulfilled. So this is something what you need to maintain broadly. And obviously all rest etiquettes, I'm sure being a healthcare provider, you need to see that the ethics and code of practice need to be followed, whatever we follow in our clinic, in our communication, in our language, and in our contents. Well, coming back to talking about various conditions, make sure that you, since the patient is talking to you for his health condition, make sure that you provide him enough information on the condition, where he can contact, he can consult, he can look at the social media, where he can look at uh, the conditions on the Google or on any other platform, and be more relaxed, be more aware of his disease. So I would just talk to you on 20th of March. We had the lockdown, and 22nd or 23rd we had this MCI guidelines coming up. For previously, this telehealth or telemedicine consultation was not allowed in India, as well as it was not being a part of reimbursement policy. So it's something which is new for all healthcare professions. As a result, we need to see what these guidelines say. I have read the guidelines of MCI, which is very, very friendly from a doctor's perspective, which is very conducive, easy to implement. It takes away all the risk of doctors, because practice of medicine is all about observations. Better you are in observing, better you are in making a clinical decision. And your telehealth consultation gives you another opportunity to be more observant of your patient's health condition. So if even if you miss a clinical diagnosis, even if you make a mistake, the MCI guideline have exempted you for any legal or any other charges that can be done, or that can be done against a doctor, or maybe a case against a doctor. So we have to see that we are following all the proper protocols, and if there's a mistake, we are covered under that. You don't need to, for general practice, if you are staying in a state, you need to register with a state. But for telehealth consultations, you need not. You just have to have one registration with your state council, and you are covered. So within India, you can provide telehealth consultation anywhere within the country. I really don't know why they have not opened it to all of the anywhere in the world, because there is no way that a doctor can check whether a patient is seeking consultation from Delhi, or whether he's taking consultation from Bangalore, or whether he's taking consultation from Dubai. So until unless we really start to do a lot of work, but no one has time. So, and many, I have read many other telehealth consultation companies which are established in India, particularly from radiology. This is a company called Future Teleradiology, which they are providing radiology consultation to at least 15 countries, I mean, around the world. So it's difficult for any healthcare provider to know where the origin is, but as per the law, we can provide telehealth consultation to only Indian citizens. Then other issues which are covered, which we have to make sure that we have to take consent from the patient. If a patient is minor, we need to see that he has some caregiver, he has a guardian who will acknowledge. We cannot issue a prescription to a patient who is a minor. And all these guidelines which are about, which covers your whole practice, you must have visit, you must have e-consent, which can be taken verbally. The consent can be taken by SMS, consent can be taken by WhatsApp, consent can be taken by interactive communication, but there need to be record of it. Prescription can be sent just to your home. Prescription can be sent to the pharmacy directly. Prescription can be sent by WhatsApp. So there are certain formats which are available on MCI guideline site. So if those of you who are interested can look at those guidelines and see how best you can follow the protocols. What are the medications? Because not all medications you can do, but not all medications you can use on telehealth. On their certain visits, there are two kinds of visits in a telehealth consultation. One is the first time consultation, which we call first visit. First visit means that the patient is coming to you for the first time for the new symptom, which has not been discussed with you before. And this consultation is valid only for 6 months. If a patient is coming after 6 months for any other problem or for the same problem, then again it is a first consultation. So first consult is valid only for 6 months. First time, one symptom. If within 15 days he has another symptom, not the same, then again it will be called a first visit. Why I'm talking about this first visit or follow-up? Because there are certain medicines which are prescribed in the Act or which are prescribed in the guidelines, which you can give only on the first visit. And the first visit medications include, which we call List O. List O suggests over-the-counter drugs. And over-the-counter drugs, if you look at most of the lubricants, over-the-counter drugs are antipyretics, over-the-counter drugs are your any paracetamol, any of those throat or you can say your cough syrups. So these are some basic safe medications which can use on the first visit. But you can still use the next line of drugs, which is called List A, which covers antibiotics, which covers other medications like skin medications. But then the condition says that you must have done a face-to-face, so not face-to-face, but a virtual consultation, whereby you have seen the patient directly. So first visit consultation covers your O and A. A, provided you have made a patient, you have seen the patients over your Zoom or over your WhatsApp, and then provided the medication. And the next drugs or list of drugs is called List B, which is used mainly for chronic diseases and which can be used for a patient within 6 months of his first visit. So it means a patient who is having a chronic disease must see a doctor face to face for next 6 months, after next 6 months. So chronic diseases like diabetes, like hypertension, like other kidney diseases can be seen by a follow-up visits, and the patients can be prescribed medication looking at those. I'll just see if I miss anything. Well, I'll come to now what are the various other, how healthcare professionals around the world have adopted this. And I will tell you, now we have some other students from radiology and from psychology. So I will just talk to them about what all has been done and how you know, those specialities have implemented telehealth into the practice. The first one was to implement, if you look at, I told you in the history, the first health profession which implemented telehealth was way back in 1950, which was the telepsychiatry. Well, telepsychiatry is one of the healthcare profession whereby even the healthcare profession doesn't see a part which is treating, means the brain. So this was something easy to adopt because you saw the patients only face to face. Even when he was in your clinic, you only looked at his symptoms, you only looked at his condition, you understood what he was. There were not much investigations required in telepsychiatry. Even the psychology, it needed more of the face-to-face consultation, it needed counseling, it needed certain behavior which could be seen face-to-face as well as on two-way video conferencing. So telepsychiatry is something which is good in the sense that it was very easy to adopt and implement. And they were the first to embrace. And even if you look at in COVID-19, the National Institute of Mental Health, they were the first one to come up with the guideline because most of the people with mental health, they had more issues, they have serious issues during COVID-19. And telepsychiatry is something which is gaining popularity because most of the doctors, most of the psychiatrists, they are concentrated or in cities, and they are not available for our rural people or rural masses. And I was very happy to see one of the startup from Goa who came up and he put up telehealth counselors in different districts of Goa, whereby he could sit in his hospital and he could do consultation. This has been accepted and taken up as a startup project by Bill Gates Foundation. This is something very encouraging for telehealth and a good sign for telepsychiatry to be proactive in this field. Then we talk about teleradiology. They have the maximum number of cases, and they were the second after telepsychiatry, whereby a radiographer sitting in his hospital could take X-ray, he could take MRI, he could take CT scan, he could take PET scan, he could take ultrasound and get a report from any radiologist anywhere at his convenience in his hospital without much issues, in the sense that just by sending the digital image, he could get the report of radiologist. Radiologist again is a very specialty where you have scarcity of radiologists. Well, we have scarcity of all the doctors, and that is one of the reasons that telehealth is not taking that leap in India, because they are so much burdened with their own conventional work that they don't have time to implement telehealth. I speak to many doctors and I look at their interest, and I find out when I speak to them, they say they are not convinced because they're already too busy seeing patients. They don't have time. And this is something not only in India, but it is a phenomenon which is predominant in most of the countries. And in Latin American countries, the government passed a law that every doctor must practice telehealth by the law. In India, they have put even in the MCI guidelines suggest that you must pass an exam That's a kind of deterrent for telemedicine. I really don't know because why they have put this condition that you have passed an exam to be a telehealth provider. Really can't understand the concept, the logic behind it, because most of the telehealth consultations are with other healthcare providers, with the patients, with other caregivers. So does it mean that you are only testing the competency of doctors? What about the other healthcare provider who is feeding you with the data, who is sitting in the primary health center and sending you all the report? What about his test? And should there be any test? To be frank, government need to think about, MCI need to think about this and make sure that they need to make it easy for everyone to adopt it into their practice. So what I'm looking at is this, that radiology I was talking about, if we see looking from x-rays, looking for uh, all radiology itself has other subspecialties whereby they become very scarce when it becomes a kind of related to pediatrics, related to musculoskeletal issues. So when you have less number of people, telehealth become very, very important. And we have to just see that radiographers, particularly those studying in the institutions, they are trained enough to see how a digital image can be sent. I will tell you about some x-rays. If you want to send an x-ray to your radiologist, you just switch on your computer screen, put the PowerPoint presentation on, keep your screen, just white, put your x-ray, click that image and send. So you don't need any other device, any other technology to send it. I personally feel that radiology is something that will always take a lead because it is just imaging. And after radiology, if you look at the next field, where we use only the visual skills to diagnose patients, is teledermatology, whereby patients can send their pictures of the wound. You can send the various lesions to the doctors, and they can get the diagnosis and treatment sitting anywhere. So dermatology was second one, which was followed. Telepathology is something that is something again in the very less telepathologist and great demand. Only 30 to 40 countries, about 35 countries, they have pathologists. They don't have pathologists in many other countries. And if you look at for diagnosis of most of the pathologies, patient need to, you can just, a pathologist can just, there is a camera which is called a multicam, which you can install in the eyepiece of your microscope, and you can, that microscope becomes your digital device to send that digital image to your pathologist. So pathology is something which is again emerging in the sense that there are about 20 to 25 subspecialty of pathology, and we see that in ophthalmology as well, we see in the kidney as well. So pathology is something that came up again in around 2000. And after pathology, we saw emergence in ophthalmology. And ophthalmology, we will be taking up a separate lecture for optometry and ophthalmologist on 3rd of August. As a friend of mine, Dr. Rashmin Gandhi from Hyderabad, he will be joining me, and we'll be talking about teleophthalmology and teleoptometry in detail on 3rd. And again, otolaryngology is something that is whereby you patients can send their ear scan, they can send the picture of the ear, and ENT specialist sitting in his clinic can diagnose the problem. The evidence-based medications that can be given safely
And if a patient doesn't recover in 2-3 days time, you can just call the patient within your clinic. And what all this is being helped or being or made possible by some of the devices, because you needed certain devices to follow this. If you look at today's healthcare profession, most of the houses today not only equipped that you have a thermometer, and the COVID-19 has made it more popular in the sense that you have the infrared thermometers, you have your blood pressure instrument, you have your glucometer within your houses, you have now digital stethoscopes. Digital stethoscope could cover, uh, you have ECG attached to the digital stethoscope, you have ultrasound that can be connected to your mobile phone, and you have a device which is called digital otoscope, whereby your mobile phone becomes your digital camera to take the picture of your eardrum, to take the picture of your ear canal. And all these devices, they can help to monitor you, they can help your patients to send their data, they can help their patients to send their pictures, and telehealth can be implemented in all healthcare professions very easily, very conveniently, and with a kind of being a cost-effective method for way of treatment for all our patients. Well, coming back to some of the implementation, I will tell you about how we talk about how the telehealth is being practiced in some of the part of the world. I would like you to look at an app which is developed by a company called D3, D capital and 3. This app is widely used in Africa to meet the challenge of child health and maternal health. And who uses this app? You will have a 10th class pass out who records the patient's details. There's a flow chart, and with the flow chart, all the symptoms of the patients are recorded, and medications are given to the patients based on his symptoms, based on the flow chart which is given to him. Most of the East African countries, particularly in Malawi, this app is widely used. And it was, I was reading more about this. They tie up with not only with the health authorities, they tie up with your taxi associations, whereby patients or the mothers who need to go for the surgeries, who need to go for the procedures, are transported to the hospital for their delivery. And this is one of the good example of telehealth where healthcare providers are not available. The other issue or the other implementation which I want to talk to you is about an organization which is called Mercy Virtual Tele-ICU. You can note this down and read about this. This is a hospital which only have clinicians and this doesn't have any patient. This is a hospital which which monitors ICU patients of 15 states in United States of America, whereby patients of different hospitals are seen remotely by the clinicians sitting in this virtual hospital. Patients are monitored by this. It's not that they say that remove the other doctors in ICU, to remove the other healthcare providers in ICU, but they provide a kind of third eye sitting remotely, whereby one clinician is watching 100 patients remotely with different parameters, and this is something which is called remote or tele ICU. which is gaining so much of popularity, and they are reducing so much of errors, they are reducing so many deaths, they are reducing so much of hospitalizations. Patients are encouraged to stay at home and do their remote monitoring from their home. All the parameters like blood pressure, like as you know, whenever patients are with chronic diseases, they need to be monitored. So this tele ICU is helping patients to recover from their home, and this is this the project is called Safe Watch, and telehealth implication of tele ICU. That this did not happen because of COVID-19. This project has been going on for last 5 years in Mercy Hospital. So what I want to stress upon is just that we take health, telehealth as a kind of a kind of side consultation or something. We don't just really focus, but serious hospitals, they have a separate department or department of telehealth, and a dedicated person, a dedicated team looking into telehealth consultations. And they spread the program in such a way that they try to reduce the number of visits of the patients. They try to reduce the, how they can reduce the cost. They try to reduce the errors. And this is something that telehealth can do, which has been difficult in spite of our huge spending on healthcare. Telehealth is something that is can cut cost. It is something that can provide a better care, and it can provide something which is more reliable in the sense that even in ICU, sometimes a nurse can make a mistake whereby a respirator can have an issue, whereby IV drop may not be flowing to the patient. But if there is someone else sitting watching remotely all these health conditions, all these errors can be minimized and are being minimized by this tele ICU. This hospital, which I mentioned about, the Mercy Virtual Hospital, again analyzes all the patients who are undergoing operations. In throughout the world, most of the at least 25% of the death happens because of this sepsis. Patients, elderly patients particularly, or even young children, after undergoing operation, they develop an infection. And there's a project started by this hospital, which is called telesepsis, whereby they work on every patient who is about to undergo an operation and monitor the health conditions to minimize and to make sure that the patient doesn't develop those infections. So telehealth is gaining so much of popularity, not just because of COVID-19, but because it is a way of practice which is going to change the healthcare industry, which is going to change the way we have been practicing. And I would urge that in whatever field you are, you need to see how you can minimize patients' travel cost, patients' time, patients' convenience, because all this costs money. It adds on to the patient, it adds on to the healthcare expense of the government, and public health, which we have not been able to reach so far. We have been to the Mars and gained in the list of one of the top countries in technology. But if we are not able to implement the technology to improve the health of the citizen, I don't think we are doing justice to the public, to the people of our country who are staying in rural areas, who have no access to healthcare providers. And whatever effort we may continue to bring on the numbers, we will never be able to meet up the numbers to send people in the rural areas. It's only the technology that can help, and technology is here. But what I feel is that the will of healthcare providers need to be there. There was a survey done in Karnataka and recently, and they done 76% of the doctors said that they are too busy doing their healthcare, traditional, conventional work. And 20% said that they don't have time to wait and adopt telehealth. And 4% said that they're not interested in implementing telehealth. But what I fail to understand is this, that telehealth is a way we can provide a convenient, affordable, a remote monitoring, a remote service to the patients sitting in their home, in the comfort of their home. And this is something what we can, we have to make sure that we, as coming from different healthcare field, can implement it, can adopt it, and can make it successfully into our businesses, into our practice, into hospitals, into our teachings, into our public health. Thank you very much, and I would be happy to answer if any of you have any question on this, something what I have talked about.
Thank you so much. And of course, all this is initial insight, what you've been saying. Yes, the country is preparing. There is already so much in, and as you said, there are apps existing and the understanding has to come in. So as you rightly said, there is a medical doctor, and then there are these technologists or these cadres who can actually be involved into the telehealth jointly. So there are a few questions here. And of course, I would request Ollie to bring in those questions from the YouTube also. So first question is, which is the minimum age for anybody who can provide telehealth? Is it the age criteria of telehealth in,
no,
or there is a...
You see, there's a, I mean, are you talking about consultation? Because they, as, are you talking about seeking consultation or providing a consultation?
I think I'll clarify that question, Krishna, to come in, if you can unmute and tell in. Yeah, so those who are
Ma'am, it's seeking, ma'am.
It is actually asking that somebody as a patient.
As a patient, okay. You see, telehealth, if you look at it, it can be done from a doctor. It can be done from a doctor to doctor for seeking an opinion. It can be done from a doctor to a patient, to attending his patient. It can be done from a doctor to a healthcare provider. Like if you are an optometrist in a primary health center, an ophthalmologist can connect with you and know the status and provide you the treatment, and you can communicate to the patient. He can also connect, a doctor can also connect to a caregiver. And a caregiver is only when a patient is a minor. You must make sure that the patient has the consent from the provider or the caregiver or the guardian is given. So there is no age. You can, because there's a pediatric, the telepediatrics is also coming up. Many pediatricians are providing telehealth. Many pediatricians are providing most of the telehealth nowadays on various platforms. So there's no age as such.
Okay.
Whenever a healthcare provider feels...
questions, sir.
Sorry?
We will have that now. One of the questions Subhashini wanted to know, would telemedicine have a negative impact on the conventional medicine practice?
You see,
if yes,
you look,
do you think this can be tackled?
You see, there are certain medical associations in, not in India, but in US, who strongly objected telehealth, who went against even telehealth, that this technology is going to create a kind of spoil a relation between the patient and doctors. But you know, they said that the patients will not get a right treatment. But this is something, a kind of myth. This is something, a kind of false proposition by that particular medical associations. Because whenever any technology comes, you see, most of us, they feel scared, in the sense that when telehealth came, we start saying that this will bring a kind of a barrier between patient and doctors. But actually, it doesn't happen. You develop more empathy. You develop more, relation with you and your patient, even if you are sitting remotely. It is just in your mind that it may be a barrier, but that's not so. And The decision was that no, it's not a barrier. It is just that the doctors wanted a higher fee, because if you look at the fees in of telehealth, it is almost 1/4 of the normal consultations, and doctors did not want to lose that out, so they went against telehealth. Even if you look at the some of the artificial intelligence applications, some of the artificial intelligence applications are very, they are kind of antagonized by some of the medical associations. They say that it's going to replace radiology, it's going to replace dermatology, but this is their fear, which doesn't really happen. But it is something that we need to understand, that these technologies are there to assist us. They are going to, even in optometry, we felt that when auto refractors came in, we felt that, oh, they are going to replace optometrists, but it did not happen. These devices, they help us to supplement, augment our decision making. So we need not to be scared and did not think that it is going to spoil any kind of relationship with our patients.
You're right to say whenever a new thing comes, there is an opposition. I remember my mother telling me when there was that old system of chula and that gas came in, even the generation behind was like, gas sex ye ho jata hai, ye nahi hai, the kitchen, even that had an opposition when that gas came. So there's another question which is saying, which has been asked by Shweta, who says, is the government working on any project to increase the reach into the rural area through telemedicine?
You see, government has a different approach to telehealth, because what I've seen is just that the government had plans, but actually it is more done by private sectors. I've not seen any government initiative on, even if you look at COVID-19 situation, I have not seen any state government coming out with observation of their patients remotely from their home. I mean, this was a time whereby they could step in and they say, okay, fine, you stay home, we'll monitor you from there. It's just doesn't happen. So the government takes its back seat. They just say that. I was listening to the speech of our Prime Minister. He said that we need innovation in telehealth, but the Ministry of Health is always, very, very laid back on accepting, adopting these technologies, and they are very slow in accepting it.
I think there is an opportunity in it for all the faculty and the educationists. There is a research which you can actually look into, and that's what we were talking earlier. We went into this slowdown. You can actually try and implement this to find out whether this can work, and if we can prove that yes, a screening process can also happen to this to refer the patient timely. I think it would have a good meaning for the government to be projected that this is where the rural population can have the benefit out of this. Okay, there is
Yes,
another question, which is like if somebody is, if we teleconsult a patient who is sitting in Haryana and you are in Delhi, right? So which state rules are to be followed? So if it is two different states, the medical practitioner and the patient.
you see, the law says that you can provide consultation to any patient sitting any part of the country. It's not clear which rule will apply for a medical legal point of view. Whether the person, because in United States they did not allow that. They say that you have to be registered in a state to provide the service. But in India, they said that you are open to provide, and obviously it is a good idea that you should be open to provide a service. But which state legality will apply in case of any misconduct, that need to be seen in time to come. It's not, the law is not clear on this.
Time will evolve, and as things move on, these things will come into application. One of the last questions is, what about patient compliance? So suppose there is a prescription or something which has been advised through teleconsultation, but how do we actually ensure that the patient has complied to what we have told them?
You see, there are different ways of monitoring patients, and it all depends how serious we are and how much we want to look at it. You see, this is a common problem not only in India, but particularly this is a problem with senior citizens, particularly with elderly people who just forget their medications, who mostly have chronic diseases, not only one but multiple chronic diseases, whereby you know it's very difficult to keep track. So there are certain intelligent ways of monitoring it. Either, as I mentioned, patients can be monitored remotely by a caregiver from the hospital, whereby patients are given some kind of intelligent pill bottles, whereby if a patient has missed his medication, the bottle will have a different color. The bottle will beep and remind a patient, whereby you have a, a supervisor dedicated to every patient who's checking that patient remotely. So there are various ways, and depends on how much we are ready to implement those for telehealth remote consultations and remote monitoring. So remote monitoring is something which is gaining a lot of grounds for senior citizen or for elderly population, and which we need to look at from
Yeah, I
in
think compliance is, even a doctor can face-to-face prescribe, but we are not sure whether the patient goes over and takes the medicine or not. So that's
See,
and also
yeah, this is what something
simultaneously it applies for face-to-face
see a
consultations
doctor.
also.
Yeah, a doctor cannot look into all this nitty-gritty. So
Yeah.
we need, like, a role of pharmacist comes in. Pharmacists
Yes.
are again, they need to, if you are a regular, like, just suppose I'm a contact lens dispenser, I keep track of my patient's contact lens uses. And when I make sure that if a person is using it, or I come to know whether he's not using it, depending upon his frequency of buying it. So similarly, chemist needs to come out with these devices whereby they can come to know whether his patient is using those medication. They can keep track of them. And I'm sure there are ways now patients are not given a prescription directly, they are given through their pharmacy. So the pharmacy can have a better role, and the chemist can play a better role in looking at this
In
issue.
fact, this question has been asked by the pharmacy faculty only, and you're
Yeah.
right to say the pharmacy is going to be in the remote control and the compliance check. Pharmacy can play a big role in this kind of thing. In fact,
See,
that's how that'll be. So there are a
not only
few questions from the YouTube which we would like to pick up, and I'd request Ollie to take up those questions, and we'll quickly have them done through in the next 5-7 minutes, sir, if you don't mind, though we
yeah,
have
sure,
exceeded
sure,
the time, right?
sure, no problem.
Okay, Ollie, if you can just come up with a few questions and read them out from YouTube.
Sure, ma'am. I think most of them already you and sir covered. So one of them is very relevant. In mountains, there is a lack of connectivity and no proper health workers. So how do we see this telehealth practice, whether it's a far-fetched or possibilities there?
You see, this is a challenge not only in India but in many part of the world, whereby you don't have uh, 3G, 4G connectivity in most of the rural areas. So this is a challenge what we have to address, in the sense that the government needs to be proactive in making sure that the sufficient infrastructure for technology is there, because without this technology we cannot reach to the unreached people.
Right. And second and last question is going to be, I'll take one. If you can share a couple of success stories, how this can be of beneficial to the healthcare system. So, for example, will make this program more useful.
You see, first of all, we have to understand is that how what success stories. If you look at, see, we are very slow in implementing, in the sense that we are in India. It is being kind of forced on us. We are just talking about telehealth because of COVID. But if you look at other countries who worked on telehealth and who are still aggressively working on telehealth, if you look at the example of this Mercy Hospital, whereby they just went on establishing a virtual hospital, without any patient in it, without without any patient's admission into this, and they connected with only hospitals around those states, track the ICU patients within the hospitals sitting somewhere else. So they cannot be a better success story than that, that how you monitor your patients when the patients are sitting in their home, their blood pressure is being monitored, their temperature is being monitored. If you look at their glucometer, now they have those patches that they put on the patient's skin to monitor their sugar level on a hourly basis. So these are some things. I'll tell you my personal experience. It was around 9 o'clock in the night, and I was I was asked by an ophthalmologist that there's a very serious patient of mine, and this patient has lost vision suddenly. And though the vision has come back, but I want his retinal evaluation to be done and his image to be seen immediately. So I checked at that particular time, and I tried to find someone who could take a retinal image, but I could not get a right person to do this retinal imaging from him. So I told that, why don't I just look at the patient remotely? I connected to the patient. I got the address, phone number, and I connected to the patient on Zoom. I did all the tests, and we realized that the patient did not need that emergency situation, was not in that emergency situation at that particular time, whereby that test was required to be done. If this patient was not, if we did not do this telehealth consultation, we would have spent all the resources, and that is what we do. All our hospitals, they make helipads, they have the transport, they have the air taxi services, but they don't implement telehealth, which is easier, cheaper, affordable for people to reach. I mean, you can save so much of, the government can save so much of cost just by implementing few strategies, few of the telehealth in few areas, particularly cardiology. If you look at cardiology, 1/3 of our hospitals admissions are in cardiology. Most of the patients in cardiology today, if you look at the admissions in the hospitals, most of them are in cardiology. And most of them can be easily resolved by telehealth implementation. Most of the patients can be monitored remotely, but that seems to be lacking. And this is something what we need to adopt, not only in cardiology, but in other field as well, as we need to see that it happens sooner.
Right, sir. I think.
Yeah. You have any more?
Sir,
I think we have all of the questions.
Okay. So I think what we sum up today is what we see and the new education policies coming up and things. I think the India in education and the world is moving on to this kind of online education, and we are transforming ourselves. But this transformation in education seems to be coming up very, very rapid. And I look into that kind of next 5 years down the lane, we may have more of virtual universities than having those face-to-face. Unless in health science, because we need the skills. So maybe because only to impart the skills, we may need the student to come to the campus. But 5 years down the line, my impression is that we will all shift into virtual university. So you'll be sitting here and across the world, you are getting your credits and you're having certifications and merging. And that's where the new education policy is also talking about.
Monica, I'll give you an example. Like if I go a year back only, if I have to deliver this talk, I have to go to a conference, and the conference have to spend at least 10 to 15 lakhs for an organization of a conference, and we did that all our lives. To impart education, what we were doing as a professional body is just that we were going to attend conferences and deliver this talk, and reach to maybe 200 people at that time, 300 people at that time. Now today, when we deliver a talk, we connect to thousands of people, and not only there, it just stays on YouTube, whereby they can get back to us and they can hear those. So this is something that is transforming not only education but total healthcare delivery as such. And this is what we are talking about. At no cost today, we are able to talk to all your students,
Yes.
field, if it was not possible, it would not have been practical if we did not use the technology.
Yeah. And that's where we have invited you, and we are happy to have you here, because we feel it is the time now India has to be introduced to these terminologies. And of course, you started practicing it also, and you have been consulting patients with it. But down the line, I think we will take in many more time from you to come in. And
you see, Monica,
as the things are evolving, we all have to learn it, and we'll be very glad if you can continue to brief us.
I will tell you about one thing. When we started telehealth, we saw its application in such a good use, like all our school screening, they can be done on a telehealth, and it can be done remotely, it can be done better, it can be done more comprehensively. I have done so much school service, and I can tell you that our school service on telehealth can be better. Even these
I
vision
think we'll
centers,
work on a project with
even the
that,
vision
sir.
centers,
We'll come up to
even-
see that, yes,
yeah,
we can implement it.
even the vision centers, which we are trying to open, and it's of no use if we just implement telehealth in those vision centers. But the only thing is that it's a question of time. Government will sooner or later understand what we are talking, and they will realize that it's a time to move in this direction. And
Okay, so
I'll
because we're running over the time, I think we will quickly wind up. And my thanks begins from my big team who has supported us, and of course Ollie, who has brought us together with no distances here mentioned, and the team from Dr. Chavi and her team who have taken this effort of conducting this session. Over to you, Dr. Chavi, for a vote of thanks.
Thank you, ma'am. Thank you, sir, for this knowledgeable session and just enlightening us with all the concepts of telemedicine. This is something new for us. As such, as a pharmacist, we know online pharmacies are there, but we don't know about the other things that they are going on in telemedicine, like in cardiovascular technology, medical lab technology, and other fields like optometry. So how they are going on in other fields. So this is a very informative session for us, so that we come to know about all the things that are going on. We are very thankful to you for sparing your time, precious time from your busy schedule, and enlightening us, all of us. So I thank you from all my students who are there, and from my whole team, those who have attended this session, and their knowledge is much more enhanced about telemedicine. And thanks again to Ollie, who has spared his time and just do all the session live streaming and all the things we all are thankful to you. And thank you, sir. Thanks to
Thank you
Monica,
so much.
ma'am.
Thank you.
Thank you, everybody. Thank you, Oli. And I know this YouTube live will remain. Everybody can repeat, see the session again. Thank you.
Yeah.
Thank you, sir.
Very true.
Thank you.
Thank you, everyone.
Bye.